day, everyone. I'm Renz Havilinar, a registered nurse and your training officer here in the emergency department. First, let me officially welcome you to the team. We're excited to have you on board. As part of your in-service educations, you will watch these video presentations focused on one of the most critical emergencies we handle in the ED, stroke and cold neuro. This training is designed to help you understand the theory and the real-life applications of protocols and rapid interventions that saves lives. I encourage you to stay put, listen closely, and remain fully focused throughout the video. Everything you need to know will be covered, and all your questions and clarifications along with the group activity will be addressed after the presentations. This session uses a blended learning approach, combining lectures with case-based discussions, so please absorb the content thoroughly. Take notes if necessary, and be prepared to engage during the follow-up discussions. Now, let us start our learning journey on a stroke and cold neuro, because in emergency nursing, every second truly matters. Good day, everyone. My name is Renz Havilinar, your training officer here in the ED. Today's in-service education focuses on stroke and cold neuro, critical topics in the ED. We'll utilize a blended learning approach, lecture plus case-based discussion to enhance your understanding and applications of these principles. So, I'm going to discuss our objectives for this session. This will guide our discussion and ensure you leave this session with practical knowledge and confidence. So by the end of this session, participants will be able to first define stroke and identify its types. Second, describe the signs and symptoms of stroke using the fast mnemonics. Third, demonstrate the initial nursing assessment and intervention during a cold neuro. Fourth, analyze the stroke case scenarios and determine appropriate nursing action. Lastly, propose strategies to improve stroke response time in the emergency department. So those are our learning objectives for this session. So what is a stroke? A stroke is a medical emergency that occurs when the blood flow to the brain is interrupted, causing brain cells to die. It can lead to long-term disabilities or death without prompt treatment. So a stroke is essentially a brain attack. Like a heart attack, it requires immediate medical attention. The sooner we act, the better patient's chances or recovery for this disease. Type of stroke. There are three main types of stroke. Knowing the differences helps tailor your response in the ED. First is the ischemic stroke, caused by a blockage in an artery. Second is hemorrhagic stroke, caused by the bleeding in the brain. It is a deadlier type of stroke. Lastly is the transient ischemic attack, or the TIA, a mini stroke with temporary symptoms usually lasted within 24 hours. So those are the three types of stroke. So stroke statistic. This statistics highlights the urgency. Every minute counts. We must act fast. So 1 in 6 people will have a stroke in their lifetime. Leading cause of disability and second leading cause of death. Time is brain. 1.9 million neurons lost per minute. So it's very important. Time is brain. Fast mnemonics. So what is fast mnemonic? Use the fast mnemonics to quickly identify stroke symptoms. It's a tool every nurse should master. F means face drooping. A means arm weakness. S means speech difficulty. T is time to call emergency response team or go to the ER as soon as you can. So that's are the fast mnemonics. Additional symptoms of stroke. Aside from fast, these additional symptoms should also be raised red flags. Trust your clinical instinct. First, sudden numbness or weakness is either left or right or both. It depends. Confusion, trouble seeing, loss of balance, severe headache, meaning the worst headache of the patient might have. So we're gonna discuss cold neuro protocol overview. So cold neuro is an emergency protocol activated for patients presenting with signs of stroke. It includes rapid triage, immediate CT scan, notify stroke team, and timely thrombolytics or the medications. So those are very important during cold neuro activation. So Code Neuro protocols standardize our approach to suspected stroke cases, ensuring no wasted time. Because time is always brain. So role of the nurse in Code Neuro. As a nurse, we are often the first to identify and respond. Your role is central and time sensitive. Quick assessment and documentations. Notify the physicians and stroke team as soon as possible. Prepare for imaging. Establish IV. Monitor vital signs and neurological signs and symptoms of the patient. So initial stroke assessment, NIHSS, is used to assess stroke severity. You'll be able to assess the level of consciousness, monitor motor function, sensory loss, and language and speech. So the NIHS stroke scale helps us quantify the stroke and monitor progressions. Please familiarize with this kind of assessment because it's very important in Code Neuro. So please go through of this information on the guidelines. So time goal for stroke management. Time is brain, brain is time, time is brain. Door to CT scan within 20 minutes, should be within 20 minutes. Door to needle or the medications or the thrombolytic should be within 60 minutes. Symptoms onset to intervention should be 3 to 4.5 hours or when the last known well of the patient. It should be the exact time, not yesterday, not today, not 2 months ago. It should be the exact time when you saw the patients being her own normal. So diagnosis tools. CT scan is usually the first. So our job is to prepare and support the patients for timely imaging and diagnosis. So we will start with a non-contrast CT scan with contrast, then with contrast, MRI, blood test, EKG, and echocardiogram. So these are scenarios that we're gonna discuss later after this video presentations. So a 65-year-old male arrives in the ER with right-sided weakness and slurred speech. Last known well was 45 minutes ago. So let's apply what we've learned here in case scenario. Think what should be or what should we do first as an ER nurse. Okay? So group discussion questions. So we're gonna discuss these questions after this presentation. So be ready. What are your priorities as a nurse? What assessment will you perform? Or what are the next steps in the Code Neuro process? So all of these questions will be discussed later after this video presentations. It will be a group discussion. So be prepared, focus. Okay? So nursing interventions for stroke. These are your core interventions. Simple actions have a big impact. First, we need to ensure airway, breathing, circulation. Administer oxygen as needed. Initiate IV access and blood draws. Maintain head midline position and monitor neurological signs and vital signs and even NHSS because that are very important in dealing with a Code Neuro patient. So be mindful, be thorough, and don't hesitate to ask questions. So medications used in stroke. These are the most common medications you will encounter in stroke care. Know the indications and contraindications. First is the antiplase, tenecteplase, that's the thrombolytic. Antiplatelets or the aspirin or the clopidogrel. We have antihypertensive, it's either calcium channel blocker or beta blocker. It depends on the provider. We have anticoagulants for the AFib patients. So those are the medications that you will commonly encounter during Code Neuro. So for post-Code Neuro care, first, we will be needing to admit the patient in a stroke unit or if not available to the ICU. Continued neurological monitoring including the vital signs. Early rehab involvement. Family education and support. That's very important because we always include the family member in dealing with a stroke patient. So after this acute phase, rehab is very important. Strategies for improving ED stroke response. So first, regular drills and simulation. Usually we're doing that every quarterly. Interdisciplinary team training, like what we're doing right now. Streamlined triage protocols. We always train our triage nurses on how to deal with a stroke patient. Effective communication channel is very important because in Code Neuro, we need to make sure that we perform the most efficient way in order for us to treat the patient. So a stroke is a time-sensitive emergency. Nurses play a vital role on the early recognitions and rapid intervention. Code Neuro protocols must be followed efficiently to improve outcome. So Code Neuro protocol is very important in dealing with a patient who has suspected or were having stroke. So thank you for being engaged. Let's continue to learn, collaborate, and deliver the best stroke care possible. And now be ready for the exciting parts, our follow-up discussion. So see you in 15 minutes. Bye. Thank you so much. Thank you for being engaged and focused throughout the video. I appreciate your time and attention. Now, let's take a 15-minute break. Once we return, we'll proceed with the Q&A sessions and group discussions. So see you shortly. Enjoy your break.